This is Chris Hill. I'm the chair and CEO of CNDXR. I'm here. I'm very happy to welcome Gil Bashe, who's the managing partner and chair of Global Health and Purpose at Finn Partners. And welcome to our wellness journey, Gil. How are you, sir?
Thank you, Christopher. First of all, I just want to say to your listeners that Christopher and I have had a very, very important conversation for the last 40 minutes or so. He is exploring, appropriately so, the functionality and, to some extent, the dysfunctionality of the U.S. health system and how he adds to helping patients. The ultimate, I think that the ultimate core of our U.S. health system is obviously making people who are seeking healing healthier. And that's complex for many reasons, and Christopher and I have just spent more than half an hour exploring some of that. Christopher asked me to share some trends or pain points, you could say, persistent pain points that we see in the U.S. health system. And I just want to review some of that. Let me give a tip of my hat to health professionals, allied health professionals, people who are toiling in our health system. These could be also administrators, billers, pharmacists, nurses, physicians assistants, allied health professionals, maintenance staff, security staff, all of them, to people involved in the drug development and drug marketing sector. My hat's off to you. And of course, to the people who have to cover the cost of all this. I also applaud your efforts. None of this is easy. All of it is complex, and all of it is highly fragmented and complex. And I would say that fragmentation and complexity is the biggest pain point of the American health offer. We don't lack amazing innovation from this country. And actually, some of our drug innovation from the United States to the world is really life-saving, no doubt about it. And we don't lack actually a community of healers across the board who want to help people. That's not the issue here. And we certainly don't lack people who need healing. Unfortunately, this country has an abundance of people who are suffering from a variety of diseases, some, not all, some at all, as a result of health disparities. That can be, of course, hypertension, diabetes, some cancers, and so forth. We actually are accosted by non-communicable diseases that result in probably about 70+% of the deaths of this nation. We spend $4 trillion on health in this country. That's twice per capita what most developed countries are spending. And we have a lower life expectancy. So it's not about our spending. I might also add that of that $4 trillion, only 11% is on drugs. So it's not because of the high cost of drugs specifically. We have a sick care system, not a health care system. We center around providing stellar care to people who are sick. And we have little investment around keeping well people, healthy. So we have to keep that in mind. Christopher, you wanted to ask something, I can tell.
As we hear you on that, and I think we're all struggling a little bit about how we can take this sick care system, as you say, to get into healthcare and maybe into well care. As we move into the new year, Gil, what gives you hope? Where are the perhaps little glimmers of innovation around patient care, even if it's a small sort of incremental step? We've seen the innovation coming in through AI and various things. Are there any indicators that we might be able to dig our way out to have a better environment for patient care as we move into the new year?
Well, we're in a big hole, Christopher. Let me say, dig ourselves out. Let's first get a ladder and start to climb our way out of that hole. I'm an optimist. As I said, we're spending enough, we're inventing enough, we're prepared to do enough. That's amazing. That's phenomenal, and we should stay that course. I think that the despair is really the catalyst for change. I think if you were to say, what is Gil most optimistic about? There is an appetite, a strong appetite for change right now. And tragically, horrifically, the murder of United Healthcare Corporation executive Brian Thompson is indicative of a bizarre urgency for us to take a look at the role of the consumer as being important to the care process. We talk a lot about cost. We talk a lot about drugs. We talk a lot about providers. We talk a lot about hospitals. We talk a lot about Medicare and Medicaid. We don't talk very much about the consumer. I think that's going to shift in 2025. I think actually we're going to start to reflect and say, are we doing our best for the American consumer? By the way, I'll just add that payers don't call people customers. They call them beneficiaries. That's a third-party term that doesn't acknowledge them as paying customers. I think if we focus on one thing in 2025, it's starting to understand that at the center, not that they're the primary focus of our efforts, the system is the primary focus of our efforts, but we've got to bring our humanity into the process in 2025. I have a feeling that that's going to become part of the conversation, and conversation often leads to action. So in that regard, I'm optimistic.
I hear that, Gil. Are there areas of organic communication between patients? You turn about terminology. I mean, it's really sad to hear beneficiary versus human being and patients. I know there's some work on social media, interesting in terms of some of the information that's come out about ways that this healthcare system can get better coming from patients themselves. Is there any hope that some of this could be organically derived from the voice of the patient, dare I say?
Look, absolutely. And I think just a reminder, we're always people, sometimes patients. And I think this desire to connect is really stems from the fact that humanity, people like to connect and be in community with other people just like them. We tend to join clubs of people who share our interests. Well, unfortunately, disease is a trans demographic interest. And so it drives people to connect with each other, regardless of where they live, how much they earn, how much education they have. I think the woman who is really confronting breast cancer feels an affinity for another woman who's confronting breast cancer, regardless of where that woman, or man, actually men can get breast cancer, where that person may live. And I think that's a unifying force. I think our tools of communication and exploration are becoming better and better. You mentioned AI. Well, AI can be a vehicle for making us smarter and a more educated consumer in terms of the conversation we'll have with professionals. It can prepare us to go into a doctor's visit in a way that we can feel some parity with the doctor and asking at least educated questions. So technology and skin in the game and communication platforms are bringing that all together. Here's a problem I'll leave you with, though, Christopher. I think the patient, the person, is ready for it. I think the culture of medicine crushes that conversation. And I think that if I were to change something, you could say, Gil, what could you change that makes absolutely good sense, that's changeable? I would say, one, in medical school, doctors have to be trained to respect the voice of the patient and the voice of the patient advocate. And they have to understand that the stethoscope around their neck that goes into their ears should not close off their hearing. They must listen to the voice of the patient and understand whether it's accurate or inaccurate. It comes from a place of authentic desire to know. So we should never shut down people's questions or desire to know or understand that the patient has the most amount of skin in the game. Medical schools need to train their physicians to be better listeners and learners, and therefore engage as partners in people's health. If that could happen in 2025, wow, we'll see a much improved medical system. So I think one, AI is giving us parity. Two, medical schools. Train your physicians on technology and listening to patients more than a few hours. Dedicate a required course to patient experience. And payers understand they're not your beneficiaries. They actually are your paying customers. That's my hope for 2025.
It's such a powerful message. Wow, indeed. As you and I discussed, through CNXR, we've been doing these group therapy, and it's interesting when the doctor can, or the nurse or the physician can just stop and listen to how the patients speak to each other. We talked about AI and the CNXR AI we're doing, but to your point, unless people are listening to the patients, it's not going to matter. So I just want to say thank you, Gil. You're making a difference, I know, and so many things that you do. You've been very generous in your time, and I just want to say thank you for spending time on our wellness journey together.
It's a pleasure and an honor, Christopher. To you and your colleagues, continued success.
Thank you, sir.